How do endocrinologists interpret complex thyroid tests? Imagine trying to solve a puzzle where each piece is a different hormone or antibody. Endocrinologists are the experts who piece together these clues to understand thyroid health. When they look at thyroid tests, they start with the main player called thyroid-stimulating hormone. This hormone is like a messenger from the brain telling the thyroid what to do. If the TSH level is high, it often means the thyroid is not making enough hormones, leading to hypothyroidism. If it is low, it can suggest the thyroid is overactive, causing hyperthyroidism. Next, they check the levels of free thyroxine, also known as FT4, and sometimes triiodothyronine, or T3. These are the hormones produced by the thyroid gland. Low FT4 with high TSH usually points to primary hypothyroidism, meaning the thyroid itself is not working well. On the other hand, high FT4 or T3 with low TSH indicates hyperthyroidism. Sometimes, T3 levels are elevated even when FT4 is normal, which can help diagnose a specific form of hyperthyroidism called T3 toxicosis. Since T3 levels tend to stay normal until late in hypothyroidism, measuring them can give extra clues. Endocrinologists also look for signs of autoimmune diseases by testing for thyroid antibodies. These are proteins made by the immune system that attack the thyroid. The presence of antibodies like antithyroid peroxidase or antithyroglobulin suggests Hashimoto's thyroiditis, which causes hypothyroidism. If antibodies such as thyroid-stimulating immunoglobulins are found, it often points to Graves' disease, which leads to hyperthyroidism. In some cases, additional tests are used. Reverse T3 is an inactive form of T3 that can be measured in certain situations, though it is not common in routine testing. Radioactive iodine uptake scans are another tool that measures how much iodine the thyroid absorbs. This helps determine if the thyroid is overactive or underactive and guides treatment options. If imaging shows nodules, a fine needle aspiration biopsy might be performed to check if they are benign or malignant. Endocrinologists combine all these test results with the patient's symptoms and medical history. They also consider factors like medications or supplements that could interfere with test accuracy. For example, taking Iodine supplements can affect thyroid test results. Understanding how these tests work together helps endocrinologists make accurate diagnoses. They look at the pattern of TSH, FT4, T3, and antibodies to see what's causing the thyroid problem. Sometimes, the levels don't match up perfectly, which can suggest issues with the pituitary gland or hypothalamus, the parts of the brain that control thyroid function. In summary, endocrinologists interpret complex thyroid tests by starting with TSH as the main screening tool. They then evaluate FT4 and T3 to classify the disorder. Testing for thyroid antibodies helps identify autoimmune causes. When needed, they use special tests like radioactive iodine scans or biopsies. They always consider the patient's overall health, symptoms, and possible test interferences. By carefully analyzing these results, they can diagnose thyroid conditions accurately and plan effective treatments.